All right, so let's begin. So, why are we having this conversation today with Jon about long-term care planning? Our goal at HCM is to help clients execute a plan to achieve financial independence throughout their lives. And at the end of life, many clients, they desire to leave an estate to their heirs, might be a charity, but along the way, not become dependent on their children. And a part of a solid financial plan is to understand the potential risks to a plan. And a potentially damaging risk is a long-term care event. So, Jon, we're going to dive right into it. So let's just start at the basics here with long-term care. So what is a long-term care event? What qualifies?
So in the world of medical providers, but really in the world of insurance, a long-term care event is defined as not being able to do two or more activities of daily living. So that's eating, dressing, bathing, toileting, transferring, continence, or being cognitively impaired. Typically in a situation like that, a doctor is going to say, and it's the client's physician that certifies whether or not the client can actually not perform these activities of daily living or if they're cognitively impaired. So if the physician certifies that to be the case, then what that means is for those activities, those are not covered by normal, ordinary medical insurance or Medicare. So if you think of medical insurance or Medicare as covering things like doctor visits or hospital visits or even going to urgent care and your prescription drugs. But if you cannot dress and bathe, say, as a result of a stroke, and you need assistance with doing that, that's not covered by, typically covered by Medicare or health insurance. So when you need to have if you can't do it, you need somebody else to do it. And that's where the costs come in.
So along the lines of the what, let's talk a little bit about the why.